I know this is not going to sound so nice, and I'm sorry, but you have sludge in your mouth. You do. You do. What's that? You brush every day, twice a day, 3 times a day? What's that? You floss every day? Both of those things are awesome. There are two of the most important things that you can do to take care of your mouth, and you are removing sludge when you brush and floss. So maybe you're thinking that I'm talking about sludge like plaque, but I'm not. I'm talking about biofilm, and I'm going to be talking about this little root, ginger. Welcome if you are new here. My name is Tanya. I'm an ex-dental hygienist turned holistic nutritionist, and I like to talk about all things health in menopause. And today I'm going to move out of my bathroom and talk to you about 4 areas of your oral health that this little root, ginger, is going to help out with. And no, you're not going to put it on your toothbrush. No, all my videos are for education, conversation, and information only. This is not supposed to be medical, dental, or mental health advice. So seek help from your licensed care provider if you think you have a health condition, are struggling with your mental health, an eating disorder, or your mouth health. The benefits of ginger in menopause, they're numerous. There are studies that show that ginger can help hot flashes and your gut. Some of the common things we think of when it comes to ginger is, of course, cooking. You can use ginger in so many recipes, and it's also great as an antibacterial and an anti-nauseant. But did you know that ginger can not only help your libido, it can help your oral health, your dental health? When I was in dental hygiene and I treated a lot of clients for dry mouth, I never thought about ginger. I thought about aloe. I thought about chamomile. We talked about xylitol a lot, which if you have xylitol, you always have to keep it away from your pets. All right, so let's get on to the benefits of ginger for your mouth, for your dental health. And the first thing I think about is one of the big things that I've been talking about, and that is gum disease. Many women in midlife find that their gums are receding. Maybe they do have periodontal disease because that can be a cause of receding gums, but there's other things that cause receding gums. Ginger contains something called raffinose that works on what we call the biofilm in your mouth. Now, biofilm can be anywhere in the body. It can be even in, I'm pointing to my sink right here because it can be in your water pipes. It can be in your shower head. Bacteria and other critters in your mouth make this stuff called a biofilm. It's like a sticky secretion, and it surrounds the bacterial cells, and they adhere to your teeth, and it can be so sticky it causes this inflammatory process against your gum tissue. This ingredient in ginger has the ability to break up this biofilm. You're breaking up the biofilm when you brush, when you floss, when you use a water pick, but sometimes it's super sticky and it's microscopic. So when you use ginger, you are decreasing the biofilm in your mouth. One study on here is talking about how ginger was used to decrease a bacteria called, and I don't remember if I'm pronouncing this right. I've studied so many bacteria over the years, but it's Pseudomonas aeruginosa. And this is a very virulent bacteria that can cause endocarditis, which affects the heart. So it would make sense to study ginger and see if it would break up and move this bacteria. Once you break up the biofilm, your body can start to take care of it and move it out. And what you're doing is decreasing the bacterial load. You can't eradicate bacteria, but you're decreasing the load. And when you think about the anti-inflammatory and antioxidant properties of something like ginger, it makes sense for oral health where we do have inflammation. And anytime we have inflammation, we have what we call oxidation. Your own cells have an oxidative process. There's byproducts, and foods like ginger and all those colorful vegetables help to fight that. That's the antioxidant potential there. Another big one in menopause, and if you're a denture wearer, you're going to totally relate to this, it's Candida, or an oral thrush infection. Candida can be anywhere in the body. It can certainly be in the mouth. We get fungus on the nails, and we also get Candida in our guts and in the vagina. There are colonies of Candida in the body. This is also part of life, but Candida can overgrow. But it makes sense to me if we're going to have Candidal overgrowth in the mouth, and I've seen it, it can be painful, it can bleed. Why can't we have it all through the digestive tract? So if you are a denture wearer, maybe you have had denture stomatitis or oral thrush in the mouth. Something like ginger can counteract fungus. Yes, there's evidence that ginger is highly antifungal, and I'm actually starting to think that the tea I'm making should be a mouthwash too. Now, no mouthwash is going to get deep down inside the pocket of a gum, but what you are doing is controlling some of the inflammation and some of the bacteria in and around above that surface of the tooth. Okay, I want to talk about something that is so common. You may not even know you have it, and that's dry mouth. We call it xerostomia. People can lose 30 to 50% of their salivary flow and not even know it. And something like ginger can help. Ginger is considered a sialagogue. It helps with salivary flow. So as you go through perimenopause and menopause, estrogen is tied to your salivary flow, to the moistness of your mucous membranes. So you may be a little bit drier. Sometimes just the act of aging can change your salivary flow. And if you are not hydrated, if you are stressed, how many of you are stressed in midlife? Let's all put our hands up here. This is a stressful time. You will have drier mouth. Going up in front of a camera or an audience and talking can leave you with dry mouth. You know what that feels like. It's like cotton mouth. Seeing this evidence in some of the research papers that I looked at, especially in a ginger spray. Now I'm thinking I'd like to put mine in a little spray bottle and spritz my mouth through the day. This can support your own salivary flow and keep the mouth moist, helping to keep bacteria at bay, helping you talk a little bit better, and helping you enjoy your food. And it will also help your overall health. One fun fact before I get to the next thing that ginger can help you with: ginger works on your nervous system. Ginger works on your relaxation state by helping make this particular chemical called acetylcholine. Acetylcholine is part of the relaxation response. And when we are relaxed, when we are in a rest and digest phase, we can make more saliva, and this will help with digesting our food. Okay, last benefit of ginger and your mouth is that it can decrease cavities. What? Cavities can happen at any age, but with the lack of saliva in our mouths and maybe missing teeth, we may go for more easy to digest, easy to chew foods that can be more simple carbohydrates. So ginger can actually work on a particular bacteria that causes cavities, and that bacteria is a streptococcal bacteria. It's called Strep Mutans. Now, everybody has the potential to have a pile of Strep Mutans in their mouth. We have all kinds of bacteria in our mouth, and it really is the imbalance of bacteria that can cause a cavity. Strep mutans eats your sugar. It's not necessarily the sugar that causes the cavity. The Strep mutans will eat your sugar and pump out some byproducts that are acidic. That's one way you can get a cavity. And another contributing factor is the fact that if you don't have saliva to maintain the pH, if your mouth is too acidic and the pH isn't maintained in your mouth, you can have demineralization in weak spots. The minerals go out of the tooth, and that can leave you with an early little cavity. So ginger, with its antibacterial properties, has actually been studied against Strep mutans, this mouth cavity bacteria, and it works to fight the bacteria. In fact, this study that I read showed that if you pair ginger with honey, it will not only fight strep, it will fight staph bacteria as well. And so you may still be thinking, like, so I'm going to drink honey with my ginger, and I already got cavities. It's not the honey, it's not the sugar, it's the acid and the pH of the mouth. Sugar is just the food for the bacteria. So did you know all these things about ginger and your mouth health, your oral health? If you did, I would really like to know. And if you have more to add to the conversation, pop it below. I'd love to hear it. And let me know if you'd like to talk a little bit more about oral health. In fact, I'd like to talk about it because my knowledge is going to get rusty if I don't use it. And it is a huge factor when it comes to overall health. Pop it in the comments below if you think this is a good little topic. We can start a playlist here, and we can keep our mouths healthy as we move through menopause and beyond. And check out my growing playlist when I talk about the gut and menopause and digestion, and all things that have to do with that. So I hope you are out there living menopause unconfined by food rules, thoughts in your own head, and what other people say about what it means to age. Let's do this together. Let's bust some rules. And until next time, just be happy.